As Peel's population continues to grow and change, so does the need to respond to our community's priorities. Adapting to community needs is critical if we are to create communities in Peel that are healthy, educated, and have a positive standard of living. Measuring how well residents are doing in these areas requires data and planning. In Peel, we have already seen much success in collaboration and planning to improve health and social priorities. Peel Counts is a group of stakeholders from across Peel Region that provides backbone support and resources to cross-sectoral organizations in Peel so they can develop a common vision, consistent measurement, and indicators to drive collective impact for social change. Using a hybrid framework of results-based accountability, or RBA, and collective impact, Peel Counts provides measurable data to inform and support planning and services across the region of Peel, building capacity across our health and human services systems, resulting in priorities that are aligned, organizations that are informed, and communities that are mobilized. Peel Counts, measuring what matters, doing what counts. For the organizations that serve our communities, working to improve the well-being of Peel residents.
As a region, having collective measurable data helps answer the big questions about community investments and well-being. For the region of Peel, it helps focus our efforts on looking at where do the gaps and barriers in service exist? Are we effectively aligning our priorities and reducing duplication in service and effort? And most importantly, are the residents of Peel doing better? Peel Counts gives the region of Peel a view of the bigger picture to help us make our decisions on where we need to invest and where the challenges may lie so we can get ahead of them and focus on the right priorities, and ultimately making our communities a greater place to live for our residents in Peel.
At the Regional Diversity Roundtable, our collective impact work is about ensuring that service is offered equitably, where diversity is centered, so that the reality for all is experienced through inclusion. Being able to measure our collective priorities enables us to measure how our organizations are furthering the work around diversity, equity, and inclusion. Quality of life, health, and education as root priorities are inherently woven in what we undertake at the Regional Diversity Roundtable. Ultimately, it is about human rights that we talk when we talk about diversity, equity, and inclusion.
Poverty is a very complex issue, and addressing it, reducing it, eliminating it requires that we work together. Agencies who deal with affordable housing, mental illness, income support, we all have to work together. Now, it's also important that we're able to measure the work that we're doing and the impact of that work. And that is why I'm very happy to know that we now have Peel Counts with us, because they will help us to document the work being done to reduce poverty and also to measure the impact of that work to see how far we are progressing. This information is going to help us to raise awareness of poverty in Peel. So we will work with Peel Counts and also use their data to inform the community about poverty reduction in our newspaper, Tough Times. So we're very delighted that we now have a national organization focused on good quality measurement in our region. We're very delighted to be working with Peel Counts.
Peel Counts is strongly invested in finding a deeper meaning in the work we do with our partners and in our community. As a convener, we provide the platform and the resources to inspire a community dialogue, to both measure and move indicators that make our communities healthier and stronger. When we measure our work, it means we can all do better because we can see the impact. Without baseline data, we would not have a sense of the gaps or the opportunities to address potential future problems through planning. This planning allows us to invest in the right priorities to improve the quality of life for all of Peel's residents.